Hi guys, good day. I'm Radial Artery from Bachelor of Science in Nursing, Section A9 from Southwestern University, Finland. So for today's video I'm going to demonstrate to you on how to check vital signs. Vital signs are useful in monitoring and detecting medical problems. Vital signs can be measured in a medical setting, at home, at the site of a medical emergency, or elsewhere. First is gather your supplies, which you need a stethoscope, sphygmanometer or the blood pressure cuff, a thermometer, and watch and a gloves, or you can use a PPE if necessary. Now, what are collected during vital signs measurement? Well, you'll be checking the patient blood pressure, heart rate, respiration, temperature, pain rating, and saturation.
So first is perform hand hygiene.
So first is introduce yourself to the patient and explain what we're going to do. So hi ma'am,
I'm Rachel Joy Sales and I'm your nurse for today.
I'm going to check your vital sign. Is that okay to you?
Yes.
Okay. So may I know your name ma'am?
Loretta Garcia Sales.
And when is your birthday ma'am?
October 6, 1963.
Okay. Then let's start with the easiest thing, which is pain. So I'm going to ask her the pain level. So can you tell me your pain ma'am? 0 for being no pain at all and 10 for the worst pain. So can you tell me ma'am the pain level?
So,
0, so no pain at all. So when your patient rating his pain to 8, you're going to ask more questions like, where is the location at? Can you describe the pain? Is it radiating? Is it burning? Things like that. Then you want to document that numerical rating along with the words with the patient used to describe his or her pain and its location. Then next is we're going to measure the patient oxygenation. But since I don't have that device, let's skip this one. So let's proceed in checking the patient body temperature. And we're going to use a thermometer and we're going to put this in the patient armpit. So before you use this, sanitize and clean this before putting this to the patient. And wait the beep sound.
You can get the patient temperature in various ways, like orally, the forehead via the temporal artery, tympanically, which is via the ear, rectally or axillary, via the armpits.
Now as we're going to check the patient pulse, as we feel the pulse, we're going to be looking for several things. Of course, we're going to counting the rate, that we are going to feeling the strength of the pulse, and we will be grading it on 0 to 3 plus. 0 for absent, 1 plus for weak, 2 plus for normal, and 3 for bounding. And the rhythm is the pulse is regular or irregular. Now in adults, the most common site to check the pulse is the radial artery because it's really easy to access.
What you want to do is find the thumb and it's found below it in this rest area along the radial bone. That's why it's called radial artery. Support your arm extended out in thumb and support it. And you're going to use your first 3 fingers and not your thumb because it has pulse in it. And find it within that area and I just lightly touch it. Feel the bounding of the pulse. What you want to do is to count it for 30 seconds. If the pulse is regular, and multiply that by 2. If it's irregular, count it for 1 full minute. So his heart rate is 85, it's regular and it's 2 plus, which is normal heart rate, and adult is 60 to 100 beats per minute.
Next is we're going to keep our here because the next thing we're going to do is check the patient respirations.
The normal adult breathing rate is 12 to 20 breaths per minute. In doing this, I will look at the patient from the side and watch their clothes. Are they rising and falling because 1 rise, 1 fall equals 1 respiration. Also, you can put your hand at the patient back and feel the rising and falling of the chest, and you will count that for 30 seconds if their breathing rate is regular, and then multiply that by 2. But if it's irregular, you need to count for 1 full minute and then document your findings.
Lastly is we're going to check the patient blood pressure and making sure the patient is sitting down and her arms is at heart level. So we're going to get our systolic number. Systolic number is the top number or the first sound. Diastolic is the bottom number and the last sound where we can no longer hear the sound.
Whenever we're looking at the gauge of our blood pressure cuff, we want to make sure we're really noting this point because it's going to tell us our systolic and diastolic number. So put the cuff to the patient and we want to make sure we find the brachial artery. It is found in the bend of the arm, so we're going to find it and it is located here. And make sure this arrow is pointing in the direction of where the artery is. Put it about 2 inches above the bend of the arm. First we want to estimate the systolic pressure, so we want to find that number. To do that, we're going to palpate the brachial artery and we're going to inflate the cuff until I no longer feel the brachial artery. And make sure to look at the gauge when you no longer feel the brachial artery because that number is our estimated systolic pressure number. Then when I go to take the blood pressure, I'm going to inflate the cuff for 30 millimeters of mercury, more than that estimated number, because we want to avoid missing oscillatory gap that can occur in some patients. So I'm inflating the cuff by feeling on the artery, and I'm going to note the point where I no longer feel the artery, which is about at the 105. Then I'm going to deflate it completely and wait about 30 to 60 seconds. And I will take the blood pressure, so our estimated systolic number is 105. So now I'm going to inflate the cuff to 135, and that will be avoid missing oscillatory gap. If one was present, so I'm going to take my stethoscope, put it in my ears and using the bell and place it over the brachial artery lightly and inflate the cuff to 135 millimeters of mercury, and we're going to let it fall about 2 millimeters of mercury per second. And we're listening for that first sound, which is our systolic number, and it's about 128, and diastolic is about 79. So the blood pressure is 128/79. And take off the cuff of your patient and clean it if it's not disposable. And you will document the blood pressure and what arm you took it in. So the normal blood pressure is systolic less than 120 and diastolic is less than 80.
So that's all for today, guys. I hope you learned something from my video. And again, I'm Radial Joy Garcia Isales from Bachelor of Science in Nursing, Section A9 from Southwestern University, Finland. Thank you for watching. Bye!